I decided to start Odyssey, I think, very early on. And I think I have to go back to when I was a kid. And my grandmother was an institutionalized schizophrenic in a state hospital in Massachusetts. And that was terrifying to me. And I've never forgotten that experience. And I always thought those folks with mental health conditions deserved more, deserved better. That's always been in the back of my mind. And the large corporations that I worked for and worked with did a great job treating vast numbers of folks with mental health and addiction issues and problems. But I always thought that this could be done better. This could be done with more individualized care, more compassion, with more resources, and that these folks with mental health conditions and addictions and eating disorders deserved that. It became obvious to me that folks getting mental health care were getting acute stabilization of their conditions and then being transitioned to outpatient care quickly. And I recall receiving phone calls from numerous families asking what can they do with their loved one now that they're through their hospital treatment, their acute care treatment, because sending someone to outpatient after being severely depressed, perhaps suicidal, homicidal, didn't seem like the best course for them. I saw a gap in the care of individuals with behavioral health care needs, particularly mental health care needs. It seemed to me that there was a better way. There should be a better way. And I pursued that initiative to start a company that could address this treatment gap. That happened in 2015 when I identified a couple of facilities that actually were doing this work. Smoky Mountain Lodge, Pasadena Villa, Life Skills of South Florida, and decided to pursue funding and financing of acquisitions to start the company to close this treatment gap and offer these intensive residential services at Odyssey. And we're going to continue to grow and treat more patients, their families, and expand to more communities.